to Medicare, the BFCC QIO, and You, a Commence Health podcast, where we bring you up-to-date information about QIO services and the overall Medicare landscape. Commence Health holds a contract with the Centers for Medicare and Medicaid Services as a BFCC QIO, or Beneficiary and Family Centered Care Quality Improvement Organization. BFCC QIOs are contractors hired by Medicare to make sure that Medicare beneficiaries receive the care they deserve. All Medicare beneficiaries have a right to high quality health care, and BFCC QIOs like Commence Health protect that right. There are three primary services that the QIO provides at no cost to Medicare beneficiaries: medical record review when a beneficiary wants to appeal their discharge from a hospital or the termination of Medicare covered services in nursing homes or other settings; medical record review when a Medicare beneficiary believes they receive poor quality or substandard health care; and immediate advocacy, which is a service Commence Health provides to help beneficiaries and their families when they're having problems with their care or Medicare covered services. This month's episode serves as an overview of the Senior Health Insurance Assistance Program, more commonly known as SHIP, and the Medicare Open Enrollment period. To begin, we're going to share a case study of Commence Health Services in action, and then move into a conversation with Yamar Santos, Assistant Director and Southeast Missouri Regional Liaison for the Missouri SHIP. She has a bachelor's in psychology and a master's in rehabilitation counseling. Yamar has worked for the SHIP program for 20 years, 15 years in Puerto Rico, and 5 years for the Missouri SHIP program as the Assistant Director, Regional Liaison, and Trainer. She enjoys helping people with their Medicare questions. The true-to-life story you are about to hear is based on stories of Medicare patients, families, and caregivers. The services that we provide help to resolve barriers to care, inspiring hope and confidence that those in need can successfully navigate their care. Any resemblance to persons living or deceased is coincidental unless otherwise stated.
I was injured in a car accident in my 30s that left me paralyzed from the waist down. I am now 70 and still very independent. Unfortunately, I do have complications that come up from time to time because I am more susceptible to certain illnesses, like urinary tract infections and pressure ulcers. I was recently in the hospital for a fracture, as I am unfortunately prone to those as well. I developed a urinary tract infection while I was in the hospital. The hospitalist ordered oral antibiotics for me, but I wasn't feeling any better. Soon after, I saw a urologist and he stated he would order IV antibiotics instead. However, later a nurse came in with my meds and it was still an oral antibiotic. I asked her, but she could only tell me that a different oral antibiotic was ordered and not an IV. I felt that there must have been an error or miscommunication somewhere, so I decided I needed some help finding out what happened. I recalled that when I spoke with a counselor from the State Health Insurance Assistance Program, or SHIP, they had given me several handouts with information about different services and resources that might be helpful. One of the handouts was for Commence Health and specifically mentioned advocacy services. Knowing that sometimes it takes a squeaky wheel to get the right attention, I called Commence Health's phone number. The advocate listened as I explained my concern, asked some clarifying questions, and explained the advocacy process. She said that she would contact the hospital on my behalf and would follow up with me once she had spoken with someone. I consented to her reaching out to the hospital. Later that day, the hospitalist came to see me. He said he had spoken with the charge nurse who had spoken with my advocate. He told me that he and the urologist had discussed my case, and together they determined there was a better oral antibiotic available that would be best for me. As long as the doctors agreed, I felt relieved. The following morning, the Commence Health advocate called to follow up with me. I let her know that the doctor had spoken with me and that a new antibiotic had begun. I was very thankful for her assistance and happy to be on the way to healing.
Super excited to have you join us on the podcast this month, Yamar, to talk about open enrollment and the SHIP. To get things started, I'd love for you if you could explain for us what is a SHIP and what is a SHIP counselor.
Absolutely. Thank you for having me. The SHIP program is a nationwide assistance program, stands for State Health Insurance Assistance Program. There is a SHIP program nationwide in every state, including U.S. territories, which is Puerto Rico and Virgin Islands. We were created by Congress in 1993 to offer Medicare assistance and education to all beneficiaries that may need guidance in understanding how Medicare works.
So, what sort of things do the SHIPs do for their Medicare communities?
We explain how Medicare works. We have had folks that come in that they're new to Medicare, for example. They don't know who they need to call or how to enroll into Medicare for the first time. And then we go over those with beneficiaries that may need assistance in terms of also comparing plan options. Each state has different plan options that they can go through, and then they're different from one state to the other. So one of the specifics that local SHIPs do is identify and describe all those varieties of plans that are available. We are unbiased, which is really great because we're not going to sell anything to anybody. We just want to explain and guide them into the right choice of plans, depending on their health needs, their medical needs, their drug needs. We do explain about special programs that can assist people if they're limited income. They may qualify for programs within their state, which can help them save money with Medicare. So we always screen people and see if they qualify for those programs. And if they want us to, we can help them assist in enrolling into those plans and fill out those applications for them if they need us to. Of course, we want to empower people. We also want to educate people so that they understand how their Medicare works and how to use that wisely when it comes to medical needs or pharmacy wise.
So, where can I access SHIP resources, find a SHIP counselor? How do I do that?
We have a website, which is the nationwide website, www.shiphelp.org. If you are from any state or U.S. territories and you don't know where to find your SHIP program, you go in there and you can just select the state where you're from, and it will give you all the information that you need so that you can reach out to a Medicare counselor. Please be on the lookout for promotion. We're close to open enrollment, so you may see promotions about your SHIP program within your state. Just, letting you know that they're available to assist you during your Medicare comparison plans during open enrollment. But we work all year round. So yeah, don't hesitate to reach out to us if you need assistance. Absolutely.
So you just brought up open enrollment. Could you explain for folks what is open enrollment? When does it start? When does it end? What's the 101 of it?
So during the year, there is the specific time period that all people that are already enrolled in Medicare, they can review their current Medicare coverage, either if you're in a Medicare Advantage plan or you're just using original Medicare and add a prescription drug coverage standalone plan. This is the time where you can review those plan options and then select a better option for 2026. It runs from October 15th till December 7th. So we are very close to that period. And I know that there may be a lot of, promotion and marketing that may be starting October 1st. I would suggest for you to look out your SHIP program first so that you can have a unbiased Medicare counselor that can assist you in reviewing your plan options for the next year.
Why do I have to sign up for Medicare specifically during this period of time? Is there anything that happens if I have to do it outside of this time period?
What a great question. Thank you for asking that. If you miss your open enrollment, and you do not sign up for any health coverage for 2026, you may end up with either the same plan that you have, because some specifically Medicare Advantage plans may do a rollover for the following year, and this plan may not be the best fit for you for the following year. Plans do change. Their providers change. With prescription drug coverage, they do change. Each plan will have a list of formulary list for their prescription drug coverage. They're not the same each year. So it's so important to review the plans that you have right now. Maybe your same plan will be a good fit for the following year, but then again, maybe not. The product of a Medicare Advantage plan specifically does add on providers like your doctors or specialists. They may not be the same for the following year. So we really recommend for you to review those options. So to make sure that you have all the providers that you need for the next year. With prescription drug coverage standalone, the same. I mean, the list of those medications that you are using this year with that specific prescription drug coverage plan may not be the same as for next year. So it is very important that if you're wanting to review those options, to do it during that open enrollment period.
So, how can the SHIP help Medicare beneficiaries during this open enrollment process? And maybe if you have like an example or two of a situation that you've helped navigate before.
Absolutely. Yes. We have folks that come in because they are wanting to see if their current plan is a good fit for the following year. As a Medicare counselor, we will go over and explain how Medicare Advantage works, or if they are enrolling a prescription drug coverage plan standalone, we will help them and we'll explain to them how that plan works for them, and how it will work for the following year. We also use tools and resources like the Medicare.gov website, and we will only use official websites so that people, continue using us as a trusted source. It will allow us to do a plan comparison, and we will use their prescription drugs that they are currently taking to enter them into what we call the Medicare Plan Finder tool. That will help in terms of at the end of that results, you will be able to see the most affordable plan options for that beneficiary that may work better for the following year. And it's a great tool to use because there has been instances where people want to stay with their same coverage, but then they find out that when we do the plan finder, one of their key medications is not part of that plan's formulary list for the following year. Or it may be that the drugs that this beneficiary is taking, the copay has been increased for the following year, or the pharmacies of their choice are not part of the plan's network. So we're really very interested in getting people on board with a plan that will best fit their medical and prescription drug needs. We also go over again screening them if they're not eligible, if they would be eligible for example, extra help, which is a program that Social Security administers to reduce costs in prescription drugs. We will screen them. And if they are eligible for that and they have not applied, we will help them apply to that program so they can save money with Medicare. If they're even more limited income and they may qualify for Medicaid, we will definitely help them apply for that program using the websites for the Medicaid program within your state, so that we can help them enroll into that and then explain how that combination works, because it's not a script that we follow. Each beneficiary has their own needs. Like you can have somebody that may have original Medicare and only has a prescription drug coverage plan and maybe needing a Medigap or a supplement. Or maybe you will have a beneficiary that's only enrolled in a Medicare Advantage plan and wants to keep that same coverage. And we will go over those explanations with that person. But we may have this dual eligible beneficiary that may have original Medicare and may be eligible for Medicaid already. But then with that type of beneficiary, there needs to be an addition prescription drug coverage as well. And there are other special needs plans that include that type of beneficiary. Where Medicare counselors come in, they have the expertise to identify those circumstances and be able to do a individualized Medicare counseling session with these beneficiaries.
Is there anything new that Medicare beneficiaries should look out through as they look ahead to open enrollment? Anything new in the world that they should be paying attention to?
Yes, each year Medicare will change. It will change. The Part B premium will change every year. Also, co-pays will change for prescription drug coverage. There is a gap for 2025 where people could spend out of pocket up to $2,000. And after that, beneficiaries would not need to pay anything out of pocket. Of course, that is if you have medications that are really high, that will actually reach that, number. So for 2026, it went up to $2,100. So a little bit higher in out-of-pocket cost. With people that do have a Medicare account under the Medicare.gov website, previously they did not require an email address to sign up for a Medicare account, but from now on, they will be required to have an email address to have a Medicare account. The benefits of a Medicare account is that they can have access to their Part B and Part A Medicare card if they lose it. They can request a duplicate. They can also have access to their current Medicare plan that they are enrolled into. Also, they can look up their drug list. It will be in there. So it will be easier for them to actually search for different Medicare plans if they would like to do that. Again, the Medicare counselor has the expertise and is willing to guide every beneficiary that would like to do this. And then explain a little bit on, the results and all other information that the beneficiary can benefit from using that site.
Let's say that I'm somebody and my birthday is in February and I'm turning 65 next year, which is outside of this open enrollment period that we've been talking to. Could you tell me about what a special enrollment period is and what that might look like for somebody like this imaginary person?
Yeah, absolutely. Throughout the year, people will turn 65 and in different months. There is something called initial enrollment period for new time enrollees. And let's say this example that you're bringing up, this person turned 65 in February, so they have 7 months overall to enroll into Medicare. 3 months prior, the birthday month, and 3 months after the birthday month. So including that fourth month, which is the birthday month, it's a total of 7 months overall. And we are in the mysteryship program. So if we have somebody that is encountering that it's new to Medicare, that's something that we also do. We explain, and then we explain when does the beneficiary needs to be enrolling to Part B of Medicare and Part A, needing to call Social Security and assist and screen if they are, eligible for those programs. In addition to initial enrollment period, there are other periods that are special enrollment periods too. And these are special circumstances where people just miss their window of initial enrollment period, but maybe it's because they're still actively working. And we have a lot of people calling because, hey, I still have an active group health plan because I am actively working. So I'm already 67. Should I enroll into Medicare? Well, the first question is, well, are you thinking of retiring soon enough? If the answer is yes, then definitely this person can benefit from a special enrollment period because of having an active group health plan. So it's just one of those examples that we do encounter outside of the initial enrollment period. This person, once enrolling to Medicare, they can use that open enrollment period that's coming up to review their plans. But we have other special enrollment circumstances, like we have people that have moved from one state to another, and they can enroll into Medicare using that special enrollment period. So just to very common examples that we encounter throughout the year for people that are needing Medicare enrollment.
Are there any other resources or organizations that are available to help Medicare beneficiaries or their advocates navigate these decisions that we've been talking about during open enrollment?
We have the CMS website, which is the Center for Medicare and Medicaid Services, available. Of course, the Medicare.gov website is always available and is the trusted resource for Medicare. The shiphelpcenter.org website is also a very important resource where you can find your local SHIP if you don't know where to call or who to turn to. Each person at the beginning of October, or probably I already know that some people have already been receiving the Medicare and You Handbook. So that is a guide where people can look for basic Medicare information, but also in the back of that book, you will also be able to find your local SHIP number. So if you're not from Missouri like we are, and you're with another state, I encourage you to, once you get the Medicare and You book, flip it. You don't even have to open it. Just look in the back and you will be able to see that local SHIP number that is close to you. And there are Medicare counselors that will be available to help you in your Medicare journey. So don't hesitate to, just look at that back book. We do work with partner sites, and each SHIP does have their own partner sites that can help with their local issues and resources. So again, I would encourage everybody that's listening to this to look for your SHIP program to guide, to have more resources within your state.
Thank you so much, Yamar, for taking time to talk to us. Wanted to give you one more opportunity if there's anything else about the SHIP program, about open enrollment that you'd like to share with the listeners out there.
We're the trusted source. This is the SHIP program. Look for your SHIP program within your state. We're here to help you. We do not sell anything. We're just here for you to understand how Medicare works and for you to have the best health insurance coverage that will cover your needs. So thank you for the opportunity of having me. And I appreciate everything that this organization is doing to expand and promote resources like us that can help people with their needs.
Thank you for tuning in to Medicare, the BFCC QIO, and You, a Commence Health podcast. For additional information on what we are up to, please follow us on social media at Commence Health or visit our website.